I want to thank Dr. Tanvi Banerjee for joining us this week. I have the privilege of working with Dr. Banerjee in research collaborations. We have a lot of fun working on natural language processing together, but her primary research emphasis is on healthcare and the biomedical sciences and using machine learning techniques and all of the power that comes with modern machine learning algorithms to understand very large, complicated, and complex data sets from healthcare and medicine. She's going to tell us a little bit about that today. And so thank you, Dr. Banerjee, for being here, and I will turn it over to you.
Well, it's a pleasure to talk to you guys a little bit about my research. As Dr. Rima mentioned, I am an assistant professor here in the Department of Computer Science and Engineering at Wright State. Uh, my research has predominantly been in the healthcare sector, and even within that, uh, right at the beginning, it's been with, again, a stronger emphasis in the geriatrics realm, which is why I also share a courtesy appointment with the geriatrics department here at Wright State. To also give you a flavor or an introduction about research, I lead the data science for healthcare labs here at Wright State. I also teach the graduate level machine learning class, which we normally have in the fall. And I designed a class on implementing techniques, so not going very deep into the algorithms themselves for the undergraduate class. So some of you might see me in the undergrad curriculum as well. And I also teach digital systems design because what many of you may not know is that my undergraduate degree was actually in electrical engineering. So it's been a shift since then. Like most labs, we do need funding. And since I work a lot with the healthcare area, my a lot of the funding, other than the one that's in collaboration with Dr. Raymer, that's funded through the U.S. Air Force Base, is funded through the National Institute of Health. So that's the NIH that you see. And I've just given these titles here. It's not really meant to be super deep. But if you kind of just see even the titles, you will see some themes popping up. And that, in fact, is the motivation for the lab. So most of my students work on research topics that align with these questions. So the first one is, how can we use sensors to monitor the chronic healthcare conditions? And when we talk about wearable sensors, we don't really build them in my lab. We usually use commercially available devices, kind of like your Fitbit, but perhaps some other variations, similar to Fitbit. But what we do want are the raw sensor level data that Fitbit does not provide. And using machine learning, so that's where machine learning comes in, can we detect behavior changes that might relate to their health condition? And when we talk about health condition, it could be dementia in older adults. It could be stress in caregivers of these dementia patients, or it could even be any topic such as pain in patients with sickle cell anemia. If we are able to do that using wearable sensors, then that's where things can get more interesting, and actually we can use it not just to detect these symptoms in the health conditions, but also employ intervention techniques, primarily using technology. So that's where, and again, these are some of the pictures you can see of the devices that we use. That's Microsoft Band 2. We also had something called the pivot head glasses. So you can kind of see a lens, which is right between the two eyes in this glasses out here in the bottom. And then there's also a wearable vest by Hexoskin that we've used in our research. So we've talked about some of these research ideas, research projects, but what is machine learning? I know you may have seen some of this in some of our earlier presentations in the mini lectures. This is a very simple example of a machine learning task, it's a lot easier to explain what machine learning is through examples, through use cases. So say all we wanted to do was detect whether or not something was either a cat or a dog. And then, we give it a picture of a cat and it says cat, hurrah. And then it sees a picture of a dog and it says, oh, wow, it's a dog. However, when we think of machine learning, there are always underlying caveats. So our machine learning algorithms, we talk about deep learning, we talk about other techniques, but they are only as good as the data that we see. So there is no magic, there's no alchemy. So if we built a model to detect who's only to where it's only seen pictures of cats or dogs, and now you give it a picture of a kangaroo, it's going to say it's either a dog or a cat. And then you show it something even more irrelevant like an ice cream, and it's going to be confused, but it's still going to spit out cat or dog. So that kind of is machine learning. I bring this example here though because in the healthcare world, our data are very noisy. So it sometimes there are cases where it's very simple to detect these health chronic symptoms, and sometimes it is just as difficult as this example with an ice cream and trying to detect whether or not it's cat or dog. So again, a very simplified pipeline of kind of the things we do. We on the input side of the pipeline, we have wearable sensors. It could be one or a combination of these. And depending on the sensor, it can be whatever modality. So we have students working on wearable sensor data, so a lot of signal processing. Then we have folks who are looking at text data, so a lot of natural language processing. And then we have a lot of folks who are working on the vision sensors. So again, a lot of computer vision level data processing. But this data is very noisy. So again, there is a lot of emphasis on feature engineering. What this means is that I'm not even getting to the machine learning model. There are these so many steps where we first have to clean the data, then we have to extract some meaningful features, and these features would vary depending on what the domain is and where the data is coming from. Once we feed it into a machine learning model, then we can detect a symptom. So this is the example of the sickle cell anemia project where we detect pain. And again, it's also how granular you want the model to be. So we can say, is this at a given time? Is there pain, yes or no? Or we can even say, what is the level of pain on a scale of 0 to 10? What is the level of pain for this particular patient using a device? Another use case study we have is the dementia caregiver study. So in this, we look at dyads. By dyads, we mean pairs. So a dementia patient and their caregiver. And we have the caregiver, in this case, wearing a sensor. This is the E4 by a company called Empatica. And we measure physiological sense signals. So what this means are signals such as the heart rate variability, the galvanic skin response. So it's a function of your skin. The We get skin conductance. So when we are stressed, oftentimes our skin sweats, right? There's water, and we can measure that using the galvanic skin response from the wearable sensors. And using that, we can actually measure the quality of sleep that the caregiver might have in the night. So again, this is a very tricky and challenging problem. When we look at dementia patients, often the focus of care stays on the person with dementia and the caregiver gets overlooked. But what ends up happening is that the caregiver is stressed for a long time, so continuously. And what happens is they have something called caregiver burnout, which means that they kind of crash physically, emotionally, mentally. And this is when they are unable as a couple to stay in their own homes and they get institutionalized. So the technological question is, can we detect this caregiver burnout, and can we detect precursors to this burnout using wearable sensors and machine learning techniques so that we can prevent this burnout from taking place, so that we allow them these older couples to stay in their homes for longer periods. And again, using machine learning techniques, we can measure the quality of sleep through these wearable sensors that the caregivers wear during the night. And even we want to then give this feedback, this quality of sleep, not over one night, but over a consecutive sequence of nights that can then inform the clinicians on the actions they need to take for intervention. So supporting the caregiver, perhaps reducing their burden, perhaps including more family members who can then help take care of the patient for certain times in the day. So again, where does the machine learning come in? So we talked about that cat versus dog. So in the sleep domain, we could say good sleep versus poor sleep, or we can even have stages. So we can say poor sleep quality, moderate sleep quality, good sleep quality. So we can again discretize and decide the levels of sleep quality, how granular we want to get with our data. Again, this is the credit for this goes to my recently graduated student, Dr. Reza Sadeghi. So he worked on using the wearable sensors and in fact came up with new signal processing techniques that can get these RR beats, so these heart rate variabilities notations between from the heart rate signals, and using just that being able to measure the sleep quality of the caregivers. And we did that not just for caregivers, we even looked at larger data sets. So this one was from a much larger publicly available data set where we had 900 patients data approximately, and we were able to then use multiple techniques. So again, there the lowest one we see is deep learning techniques, so where we just throw in the raw data, don't worry about the feature engineering side, and then it can give us 3 levels: light, medium, deep sleep. Or we can even have get that from the electronic health records, or we can even do some feature processing and then have first estimate the sleep stages and then predict the sleep quality in caregivers. So again, we just the point of this particular slide is to show that there is no one way. There are various ways that we can look at to address the same question, which is predicting sleep quality in caregivers. If you are interested in knowing further about this project, please shoot me an email, which I will show you at the end of the presentation, and I'd be happy to share some papers on this work. So not just that, we try to do a more holistic side of looking at caregivers. So we even looked at smart gaming applications to measure the cognitive status of older adults. So often the caregivers of dementia patients are their spouses. So they are also older adults who may have cognitive decline. So we look at ways of using gaming technologies via uh, tablets or smartphones, and are able to come up with some features that we again put inside some machine learning model to look at their task performance in this case, which is again a measure of their cognitive status. So again, this is just meant to be an overview of some of the different things that the students work on. And then the last project that I want to talk about in the healthcare realm is in that sickle cell anemia domain. So where my colleagues, so we have again, like Dr. Raymer mentioned, we work a lot collaboratively. So this particular project is done with in collaboration with Duke University. So they are the medical leaders for this particular project. And then we also have someone who's working from the mathematical side from Northwestern University who's looking at modeling pain using uh, mathematical models and using this mobile application, which gives us some symptoms about the sickle cell disease patients. And then we have this wearable sensor where we can get these different heart rate and that skin response and even their step. So activity features, can we use that to measure their pain? Because this is pretty tricky. There is no cure for sickle cell anemia. So even now, the state of the art is to manage their pain symptoms. That's all they do from the medical side. So how can we use technology to get there, because again, if this is not monitored over time, then there are pain crisis events which lead to hospitalization. There can also be over medication because the pain gets out of control. So we want to keep that balance to ensure the quality of life of the patients is maintained, again, through the use of technology. So in this case, we used a Microsoft Band 2. Um, and this was that simple pipeline that we had seen earlier, where the patients wear this Microsoft Band 2 and they respond about their pain symptoms via this app. And then we use this to model their behavior using the physiological data and see whether we can detect the pain, a yes or no, as well as look at the level of pain on a value from between 0 and 10. So in the previous example, we had talked about machine learning as saying yes or no, but that's not the only way. We can also treat it as a continuous value. So this is what we see in this particular graph. This is called regression, where we are treating the output pain as not a value from 0 to 10, but a spectrum between 0 and 10, because that replicates what a person might feel. It is not a discrete value, it's not a discrete state, but it might be a continuous value between 0 and 10. So one way of evaluating that is looking at the root mean squared error. And what we often do is look at multiple algorithms and see how they perform one versus the other. And on the x-axis here, you can see the number of features. So what we did is we have 6 features coming in from the Microsoft Band 2, but now for each of these features, we create more features. So now we are even playing with the number of features that come into our machine. Why do we do that? Well, so because it's not just important to look at the performance, we also want to look at what features are playing a stronger role in the pain. In this example, in the pain of the sickle cell disease patients. So in our research from our data, what we found was in the physiological measures. So for one thing we did is we separated out the physiological measures and the activity measures. And then from the physiological side, we saw that the skin responses, skin conductance, so their stress level played the strongest role to compute their pain, to evaluate their pain. And this might be surprising, I think. So again, our clinicians found that pretty insightful. And then similarly from the activity, we found that the steps, the accelerometer data was more useful than the angular, so the gyroscope measurements. So this was perhaps a little less important in this particular study. So again, when we look at healthcare, the one thing we perhaps differ in as compared to maybe a lot of other researchers who also work in machine learning is that we are not just concerned about the performance of the machine learning models, but we also might be interested in the transparency of the models. So we care about looking at which features are playing a stronger role. Because even at the end of the day, the clinicians, the doctors want to know why our model is predicting that this patient might have a high pain versus somebody else who may have a low pain. So this is kind of the overview that I wanted to give you in today's presentation. As I mentioned earlier, with these healthcare projects, it's never one person, it's always a huge team at the back end. So we have all the students working in this project, students not just from computer science. We've had students from the med school, we've had students from social work, and we've also had faculty from geriatrics, School of Medicine, from biological sciences, as well as social work, who've actively collaborated with us in these projects. And again, if you have any questions, please feel free to contact me at my wright.edu address. And we also have all the faculty members have web pages, websites also to give you a feedback, an overview of what all we work on. So with that, I would like to conclude our talk today.
This is a question that I get a lot from prospective students, and it's very relevant to the kind of work that you do too. Um, if an undergraduate student wanted to come in and they found this appealing because they thought, gee, this is neat, computer science, but yet I can really help people do healthcare kinds of things and have a real impact. I want to get involved in that. Um, how much biology slash medical related knowledge slash statistics should they have coming in um, to get started?
That's a very good question. So, at least from the medical side, I really don't have any expectations of knowledge that we'll build on as and when you get involved, as and when the student wants to get involved in that project. Because usually we start small with very small tasks. What normally happens is for somebody coming into the research team, they work closely with a graduate student who is already pretty vested in the particular project, so who can show them the ropes. That said, from the computer science side, prefer to have at least one or the other. Either you have a strong stat or math background. And again, it doesn't matter. For me, it's more about if you have a strong, either it's math or a stat background, it's easy to pick it up, the remaining, whatever that might be, even from the machine learning side. Or even if that is not the case, then perhaps at least having a strong programming language. Only one, and that's fine. Uh, so this is probably my expectation. And I should say that I'm sure there's a variation or a variance between even the different faculty members on what they do for incoming students. I would also like to say, though, that there have always been exceptions to all of these rules that I said. So the best approach would be to make contact with some of the faculty members that you may be interested in working with, and just tell them, just have a one-to-one meeting with them and discuss your skill set, your background, and then move from there.
I thought of one more. So then, if a student was thinking about, um, they're getting ready to come into computer science, they're interested in machine learning, they're interested in healthcare. Um, what would you recommend for them, like over the summer, to get ready? Is there a programming language you think they should learn, or tutorials they should do, or how do they get ready to come in and be ready to hit the ground running when they get here?
From the research side,
Yeah, if they want to get involved
okay.
in research, so they're saying, boy, Dr. Banerjee is doing interesting things. When I get there, I want to be able to, I'm a brand new student, so I want to get up to speed as fast as I can and get involved in research somewhere. Um, how do they get ready for that? Is there a particular language they should learn? Is there a
Very good
particular?
question. So, uh, the 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 actual answer is that there are multiple languages. However, if a student doesn't have any preference coming in, I usually recommend them to get into Python because, in terms of the industry, that's what they assume that a computer science student who may have interest in machine learning probably knows. So, and I do know that there are free tutorials out there, such as Udemy and all, which have some tutorials on how to get started with Python. So that's probably one I would suggest. And the other one is, again, if it's a specific lab, it's always a great idea to stay in touch with some of the members of that lab. So they can also guide you through certain um, paths. So this is for somebody who's just starting out, but I'll give you examples. So one of the projects that I mentioned was the app building, right? So I do have an undergrad student who's currently just working on Android programming, and he does not know Python. So again, there are exceptions, but then now he's spending time. That's all he's doing, learning the Android platform.
I'm reading a question on the board right now. So the question is, how would the study that you did for dementia caregivers transfer over to the caregiver of a terminally ill patient? And is that something that you're thinking about looking at?
We normally haven't because often when someone is terminally ill, uh, towards the end of their life, they are going to hospice settings. So they're by hospice, and again, hospice just means that the patient is towards the end of his or her life, and it's just caring for their symptoms. So again, it's usually pain, and it's not really, at that point they're not trying to cure the disease, they're just curing the symptoms. And even then, there are variations. Sometimes the patient is just spending the rest of their days in their home, which is pretty rare, or they go to nursing homes. So most of our focus in the caregiver project has been where the caregivers living with the patient, because that's when the stress happens. When we talk about dementia, one of the common symptoms is wandering, and also there is a tendency for the dementia patient to get stronger symptoms after sunset, in the evenings. The disorientation,
Hmm,
the wandering, that seems to get exacerbated in the evenings and
interesting.
goes into the night. So they are, which affects not just their own sleep, but the sleep of the caregivers. And these caregivers might be their adult children, might be their spouses, or might even be a relative who may have other duties. We've had folks who are taking care of their grandkids while taking care of their husband with dementia. And then we have folks who are also working still. So it's a pretty challenging and multifaceted problem. But no, we've not looked at terminally ill. That I wouldn't say we're not interested, but I would say it's a different problem.
Any additional questions I can forward along?
And again, as I said, if you have interest in this study, do shoot an email if so I'd be happy to discuss this further with you.
I have one more. Are any of these technologies already used in healthcare settings?
There are not definitely not by my team. So we are on the research side, so we just care about building prototypes. But from earlier, I worked in geriatrics even as as a doctoral student. So one of my former classmates then, they built a company called, I forget the name because they had one startup and they closed it and started another one. I think it's called Foresight, and where they used these Connect cameras to detect falls in older patients. And it is a successful technology that's in use in nursing in assisted living facilities in, I think, Iowa and Missouri. Yeah,
Outstanding. And I think that kind of shows the process how this generally works. A lot
right,
of times, those of us on the pure research side um, generate prototypes, show proof of concept, publish our results, and then
right,
companies will pick that up and then they will embed it into devices. So even right now, if you get a new modern smartwatch and that smartwatch is able to automatically tell if you're running, walking, um, doing push-ups or weightlifting, or they have all kinds of activity detection that happens. And I'm constantly amazed that my smartwatch can tell what I'm doing just from the movement of my wrist. That 4 or 5 years ago, those were all research papers in taking
right.
those kinetic trajectory data and turning it into interpretations of activity. So we kind of do the basic um, proof of concepts, and then
Right.
companies pick all of that up, and it does get embedded into all kinds of devices out there. Sometimes we don't even know where it ends up going.
Absolutely. And yeah, often it just stays as papers, but there are definitely times when they get used in real life. In the healthcare setting, it does get trickier. Like this company that I mentioned, it was because my former advisor was more interested in that path. You can look her up, Dr. Marjorie Skubik from University of Missouri. She took that patent route. It's a fairly unusual route to go, uh, which meant though that there were fewer papers. And I do think there was challenge in the beginning, especially. I would say it was about a 10 to 15-year process before this company took up,
Mhm, mhm.
started up. Yeah,
And sometimes there are trade-offs between
yeah,
deciding whether you want to get things out into the scientific community or try to push hard to get them into industry and in the hands of healthcare providers through that different pathway. And so
absolutely.
that's one of the considerations that we have. And yeah, new smartwatches can in fact detect falls,
Right.
and and a lot of
So
that
that
has
particular
been studied
technology,
carefully.
we did not want to use wearables because often, there is that Philips device that's used for falls, but what ended up happening was the older people were not wearing them when they fell. So
Right,
the idea of the Connect was that now it's just there in your living
right,
space. So it
right,
just
right.
automatically detects it. So again, there are always trade-off choice between the wearable devices or not. Um, uh, Not having wearable devices meant there was a huge infrastructure. So we had optic fibers because this is imagery data getting collected all the time. So again, this is, I mean, there are a lot of challenges, I would say, and also like research questions in each of this data compression, you name it. There are many aspects to each of these projects.
Yeah. And then, oh, so this is a question about a technology that I've read about a little bit. What about contact lenses that can sensor glucose levels? Have you heard of those?
I have, but I do not know the specifics of how they do that.
I don't
Uh,
either.
yeah, yeah,
The connectivity is an interesting question there, but they have managed to get things, they have all kinds of interesting technologies for low power um, readout. Mentioned that Google is working on
right.
that.
So
Um,
not just Google, I know Apple is working on stuff. I know Apple has strong partnership with Mayo Clinic. Google definitely. IBM and has been having strong partnership with multiple med schools, top med schools in the United States. So they're all doing it, but and it's not new. They've been doing this for several years now. I think that itself, I think, would be telling that we don't have as many products out there because all of this depends a lot on how much data there is and also how noisy that data
Right,
is.
exactly. A lot of our very best techniques that we have for machine learning today depend on having enormous amounts of data available.
Right.
And if you go back to the methods that people are using when there's not a very large amount of data available, many of them are the same methods that were in use 10, 12 years ago.
Exactly.
Um, the things that are moving really, really fast are the very data rich machine learning methods. So when there are
Right.
humans involved, it becomes an extra layer of challenge to collect that much data.
Yeah.
Yep. Outstanding. Okay, well, I think we will wrap it up there. And I'd like to thank everyone for the great questions, outstanding questions. And thank you very much, Dr. Banerjee, for sharing your expertise with us.
Thank you.